All right, hello. My name is Brian Havens. This is part of my diagnostic module, and this is part of my review of two of the other diagnostic modules from fellow members of the cohort. First, I'll introduce the topics that I chose and why I chose them. Specifically, I chose from Deborah, thoracic outlet syndrome, and from Ricky, rheumatoid arthritis. I chose these both for different reasons. Rheumatoid arthritis being a condition that some of my family members have had, and so I have some personal interest in it, as well as being that there's a family history of it, not unreasonable to expect that I might one day experience it. And then for the entire opposite reason, thoracic outlet syndrome by Deborah, because I didn't know anything about it. And so in speaking about how these built upon my knowledge or experience of the topic prior, for thoracic outlet syndrome, pretty easily. I didn't know a lot about it, and so the vast majority of the information was new to me. I've always got kind of this interest in the thoracic kind of cervical areas. Like it's such a unique and delicate interplay of blood vessels, arteries, veins, nerves, muscles, everything just seems just so in order for it to function. And so I'm always really fascinated with the ways that those things go right and the ways that they go wrong. Obviously, and both are related. Again, for Ricky's presentation over rheumatoid arthritis, I had some personal interest in it because I have some family members that have experienced it. And so I have some intimate awareness of some of the day-to-day functioning issues and stuff like that. But I was interested to learn more about it, and specifically learn more about some of the more, like, was it disease modifying medications, some of the surgery options. These are things I didn't really know about. And that was partly why I chose his presentation, is because I knew it was a condition about which I knew a little bit, but I could probably stand to augment that knowledge to some degree. As for what I learned about them and their relationships to impairments, activity and participation limitations, for Deborah's presentation over thoracic outlet syndrome, very near and dear to my heart is the idea that, particularly in some of her examples, talking about postural deficits in the way that we sit and the way that we move or the way that we work. And I'm very much guilty of that. You know, being a student at the moment, I spend a lot of time seated at a desk. And so I spend a lot of time with my shoulders forward and kind of internally rotated, a lot of time hunching and sitting, my hips in flexion, all this and that. And so it was a little bit enlightening and maybe a little bit of a warning flag for me to see that there are outcomes to this. You know, there are deficits to be experienced from some of the lifestyle choices that we have, or occupational choices. You know, in her example, she mentions one of the outcomes for her diagnostic module for her ICF is the inability to participate in yoga and the inability to work for long stretches. And both of those are things that I would like to be able to do. And so it was interesting kind of considering the backwards ramifications of something like that that does possibly come out of complications from postural deficits and work habits and all the rest of it. As for Ricky's presentation about rheumatoid arthritis, one of the interesting points that he makes that I really took to heart was thinking about treatment patterns. And so when someone has all this irritation, synovial irritation, maybe limitations in joint movement, et cetera, you're looking not just at maybe the strict confines of inflammation and a lack of range of motion, you're also looking at probably associated muscular weakness, possibly also a lack of motivation, and you've got maybe some physical deconditioning as well. And it made me kind of think about the ways in which we ought to consider people that we treat in a more holistic manner. You know, it's very easy to be, and I probably fall prey to this, to be overly clinical and to think, okay, these are the presenting signs and symptoms of something like rheumatoid arthritis, autoimmune condition. And instead, it might be more interesting, more worthwhile, more beneficial, more productive to consider things like, yeah, if somebody is coming in with, let's say, advanced rheumatoid arthritis, what might their motivational levels be like? And should that be of clinical concern? And I would argue that it should. And so I thought it was interesting that Ricky included that in his presentation, because it wasn't an idea that I had really given much thought before. As to my view of physical therapy as a medical profession and my thoughts of it as a teaching profession, I do really enjoy moments like this, both in being assigned something that I can then present to someone, as well as then being on the receiving end of it. I find these kind of active learning things really interesting and valuable and worthwhile. There's also something, you know, there's that old thing, you never really understand something until you can explain it to your grandmother, you know? And so I find it interesting teaching myself these things so that I can teach someone else, so I can explain it. And then having that favor returned to me, I think has been really interesting. And, you know, imagining that not every PT patient is going to be a football player or a tennis player. You know, some of them are, as in Deborah's example, somebody who works at a desk all day, you know, and might live a relatively normal life, but for whatever reason, experiences thoracic outlet syndrome and needs treatment, you know, and they may come from a variety of walks of life and motivational levels and education levels and cultural levels and all the rest of that. And that kind of jumps back to the earlier point that I'd made about Ricky's presentation, in that I appreciated in his planning, that he talks not just about the clinical presentations and the signs and symptoms and the prognosis and the treatment, but also the motivational concerns, maybe the apprehension that the patient might be experiencing. And it kind of lit a bulb in my head of thinking about people in a more holistic manner, because it is probably overly simplistic to consider that in treating a shoulder injury, you're just treating a shoulder, you know, like, at the risk of sounding trite, the shoulder is attached to someone, you know, the shoulder is attached to a person. And so I found it really interesting and valuable and worthwhile that in both of their presentations that they were able to tie those things together, and it created a common thread for me, which is an area that I would like to be more careful about and more considerate of as I move forward. I think it's a challenge for me in learning to be a clinician to not always be overtly clinical, you know, to leave some space for, again, a little bit of a holism, a little bit of a holistic treatment of people. And so I appreciated that in both of their portfolio presentations, and I hope to kind of take that forward and adjust and implement that into my own learning and development. Thank you.